My name is Alexia, and I decided to do a video for the first part of the Module 3 article assignment for the Leadership and Management class. So going off of that, like I said, I will be doing the first part in a video format. The first part is going to follow the article Feasibility of Integrating Occupational Therapy into a Care Coordination Program for Aging in Place by Dixon and Totto 2018. The first question is, what type of study was it? So essentially, it was a feasibility program evaluation study that centered on evaluating and examining how occupational therapy services could be integrated into already established long-term services and supports. So basically, it was like a coordination program in which we could analyze how effective occupational therapy could be integrated into this. It was kind of like just like a single group study, rather than a typical controlled trial. The second question is, what were the primary aims of the study, secondary exploratory aims? So the primary aim was to, like I said, analyze how integrative occupational therapy could be into a long-term service and support care coordination program for older adults aging in place. So that was the primary aim. However, like secondary and exploratory aims were to also assess like any benefits of adding OT, like how, aside from the primary aim, which is to see how effective it is and to examine, we can also be as a kind of like second data evidence to reinforce what we're trying to do is we would assess the potential benefits, and then we'd also like identify occupational therapy could be used to identify any barriers that you wouldn't see right off the bat, like they would be further in depth. So that could be a secondary aim and / exploratory aim as well. We'd also probably want to assess whether the patients are happy with it, compliant with it, and whether they're ready to make some changes. The third question is, what instruments were used to collect data? So the main instruments that were utilized to collect data was the goal attainment scaling, which is the GAS. It's kind of like ready to evaluate, like I mentioned earlier, ready to evaluate the change in patients, whether they were ready to or not. And it's also good for establishing goals because it is goal attainment. There was also the in-home occupational performance evaluation, which is the IHOPE, IHOPE. It's basically performance-based, and it's to identify any challenges or difficulties with completion of meaningful activities or occupations in a home environment, and how certain things contribute to it. So whether it's okay, can we like not do self-care? Why can we not do it? Is it because we don't have the safety rails? Is that a limiting factor? How can we improve that? Those were some main ones. And then the fourth question is, what were the results? So the results were indicated that out of the 23 patients that were referred to OT services during this 16-week trial, only 16 were evaluated. So out of those that were evaluated, we concluded that, according to the article, that only about 37% were reflected that they were ready to make this change. So that's not very many. And they wanted to participate in occupational therapy services. However, they each established like individual goals, and they all like were able to attain their goals out of the ones that indicated they were ready for change. However, only about 87% determined, based on the instruments, determined they met or they were ready to integrate occupational therapy services. Essentially, the other instrument was the IHOPE, which was utilized to identify like personal factors and to barriers in aging in place. So that was good because it kind of reflected like any gaps that OT would need to address and fill. So if I were to summarize the author's conclusion, I'd probably say that integrating occupational therapy services into these long-term service and support care coordination programs is pretty feasible. It's also great for like a client-centered approach because occupational therapy is very client-centered. It's great for identifying barriers, setting meaningful goals for these people, and especially for the people that are ready to make change. And then again, helping them maintain independence while they age in place. So yes, I think it is great that occupational therapy can be added. It's great for like performance-based assessment. It's great for these functional barriers that limit a person. So yes, we should be able to incorporate these and help motivate older people to achieve their goals and maintain independence.